Good morning, everybody. I'd like to pass on the regrets of the CAO president, Paul Jeannot. He couldn't be here, so unfortunately you're stuck listening to me for a few minutes. I'd like to thank everyone for the opportunity and thank the board of directors for the opportunity to speak to all of you this morning and share some of the activities of the CAO over the last year and also what's to come over the next few months. So I'll start by saying that CAO understands that we're speaking on behalf of Canadian optometrists, of all Canadian optometrists. We know a strong national voice demonstrates cohesion and authority, which is critical for a small profession like ours. So when we sit at national tables, we're among much larger and more influential professional associations. It's therefore incumbent on us to be more strategic, agile, and collaborative if we're going to achieve our goals. So following the path outlined by our strategic plan and the priorities expressed in the 2013 member survey, which many of you participated in, we are building a stronger and more effective national voice. To make our voice heard among the hundreds of associations vying for government attention, we use expertise. In 2014, CAO hired a veteran team of employees with experience in government relations, marketing, communications, and membership. Our government relations manager has more than 20 years of experience in the field and has led some of Canada's largest lobbying campaigns, including those for the Canadian Medical Association, Engineers Canada, and the Heart and Stroke Foundation. With her assistance, CAO launched the 2014-2015 Government Relations Strategy with a day on Parliament Hill last October during Children's Vision Month. The meetings resulted in our president's invitation to the Minister of Health's Innovation in Healthcare panel and a request to meet with the Ministry of Public Health in order to pursue public-facing projects. In January of this year, optometric leaders from across the country met in Ottawa to discuss the future of optometry in Canada. The 2015 Optometric Leaders Forum investigated the implications of change and what was needed to support and guide the profession. CAO took the opportunity of the gathering to meet with leaders from the Canadian Ophthalmological Society, CNIB, the Canadian Opticians Association, and other eye health stakeholders at an evening reception. Since our relations with influential stakeholders also contributes to our being seen and heard by decision makers, we have also engaged the Canadian Medical, Dental, and Pharmacist Associations, the College of Family Physicians of Canada, the Canadian Glaucoma and Diabetes Societies, and many others. These relationships continue to evolve and serve to promote the role of optometry in Canadian healthcare. In the last year, CAO Council has approved and released position statements on telemedicine, managed care, cosmetic contact lenses, and many others, staking out optometry's role in the evolution of healthcare policy. Presently, we're developing several memorandums of understanding, and we're part of a newly inaugurated all-party, multi-stakeholder caucus, seniors caucus rather, on Parliament Hill. Our president is also an invited participant in the Great Canadian Healthcare Debate in June, hosted by Healthcare Can. It is clear from our increasing profile in the national healthcare stage that the CAO's initiatives in policy and government relations are bearing fruit. And as many of you know, in 2014, we relaunched the Canadian Journal of Optometry with a new look and editorial board and a renewed clinical focus. As the profession continues to expand its scope of practice, we need to ensure that relevant research and practice information is available to our members. As we have seen this weekend already, today's research is tomorrow's practice. These changes resulted in the release of the first ever CJO supplement in 2014, which was available to everyone in your little blue bag when you signed in. The National Dry Eye Disease Guidelines supplement was so well received that we are now preparing to release a second supplement in June focused on treatment options for patients with cataracts. So look for more changes to the CJO in the coming year as well. In our fast-moving landscape, regular and easy access to information to our members was also a key consideration. CAO also revamped its website, creating a hub for information, including the new online resource library that makes guidelines, some of the policies that I mentioned before, articles, research, and many more resources readily available with a simple keyword search. The new website also allows members to reach out to each other through private messaging and discussion forums across the country. Incident reporting has also been simplified, which allows CAO to gather information and spot trends in practice, which are used in government lobbying efforts. In its first 6 months, organic growth alone has seen the website traffic double to over 8,000 sessions a month. Our focus on information sharing will continue at Congress this July in Fredericton, New Brunswick. The CE program theme, Technology and the Future of Optometry, will focus on leading-edge technology and trends that impact society and the future of optometric practice. For the first time ever, the Congress will host a poster session featuring novel Canadian research and clinical cases, which we hope will stimulate discussion and allow for a more personal exchange of ideas around new projects and research taking place in Canada. Registration for Congress is now open online, and I encourage you all to attend. There are fewer cities more beautiful than Fredericton, New Brunswick in the summer, and I'm not just saying that because I was born there. This is only a sampling of CAO's work over the last year, so I encourage you all to check out our report on the OAO website, which has been posted on the members' side. We have made many improvements to our member offerings, including the CCOA program, the Optometric Assistance Program, and the Vision at Work program, which is formerly known to you as the Occupational Vision Program. And hopefully some of you were able to visit the CAO booth yesterday on that, the new and improved OVP. The full annual report from CAO will be available to all of you in July. So thank you all for your kind attention, and enjoy the rest of the morning.